Hello everyone. Today, we will be talking about bipolar disorder. So, let's jump into it and start from the overview. Bipolar disorder, formerly called manic depression, is a mental health condition that causes extreme mood swings that include emotional highs, mania or hypomania, and lows, depression. When you become depressed, you may feel sad or hopeless and lose interest or pleasure in most activities. When your mood shifts to mania or hypomania, less extreme than mania, you may feel euphoric, full of energy or unusually irritable. These mood swings can affect sleep, energy, activity, judgment, behavior and the ability to think clearly. Episodes of mood swings may occur rarely or multiple times a year. While most people will experience some emotional symptoms between episodes, some may not experience any. Although bipolar disorder is a lifelong condition, you can manage your mood swings and other symptoms by following a treatment plan. In most cases, bipolar disorder is treated with medications and psychological counseling, psychotherapy. What is bipolar depression? Bipolar depression is part of a larger condition called bipolar disorder. Specifically, the lows that you may be feeling, those moments of hopelessness, these are the possible symptoms of the depressive moments associated with bipolar disorder. Bipolar depression is a lifelong condition that creates unusual mood changes that can vary in length and severity. You can go from feeling revved up and euphoric to feeling down and hopeless. 5 signs it might be bipolar depression. Having one sign alone does not mean you have bipolar depression. 1. Having sad, empty, or hopeless feelings most of the time, or depressed most of the day, nearly every day, is a possible sign of bipolar depression. 2. Trouble sleeping at night and staying awake during the day. Insomnia, difficulty failing and/or staying asleep, and hypersomnia, sleepiness during the day, are possible signs of bipolar depression. 3. Often feeling worthless or very guilty. Nearly every day, having an excessive or inappropriate level of these feelings is a possible sign of bipolar depression. 4. Symptoms causing work, family, and social life to suffer due to your mood. These important areas of life are a possible sign of bipolar depression. 5. At times feeling very euphoric, revved up, and/or irritable. These feelings are ways to describe mania. Let's look at this in a little deeper level. Mania and hypomania. Mania and hypomania are 2 distinct types of episodes, but they have the same symptoms. Mania is more severe than hypomania and causes more noticeable problems at work, school, and social activities, as well as relationship difficulties. Mania may also trigger a break from reality, psychosis, and require hospitalization. Both a manic and a hypomanic episode include 3 or more of these symptoms. Abnormally upbeat, jumpy, or wired. Increased activity, energy, or agitation. Exaggerated sense of well-being and self-confidence, euphoria. Decreased need for sleep. Unusual talkativeness. Racing thoughts. Distractibility. Poor decision-making, for example, going on buying sprees, taking sexual risks or making foolish investments. Symptoms in children and teens. Symptoms of bipolar disorder can be difficult to identify in children and teens. It's often hard to tell whether these are normal ups and downs, the results of stress or trauma, or signs of a mental health problem other than bipolar disorder. Children and teens may have distinct major depressive or manic or hypomanic episodes, but the pattern can vary from that of adults with bipolar disorder. And moods can rapidly shift during episodes. Some children may have periods without mood symptoms between episodes. The most prominent signs of bipolar disorder in children and teenagers may include severe mood swings that are different from their usual mood swings. When to see a doctor. Despite the mood extremes, people with bipolar disorder often don't recognize how much their emotional instability disrupts their lives and the lives of their loved ones and don't get the treatment they need. And if you're like some people with bipolar disorder, you may enjoy the feelings of euphoria and cycles of being more productive. However, This euphoria is always followed by an emotional crash that can leave you depressed, worn out and perhaps in financial, legal or relationship trouble. If you have any symptoms of depression or mania, see your doctor or mental health professional. Bipolar disorder doesn't get better on its own. Getting treatment from a mental health professional with experience in bipolar disorder can help you get your symptoms under control. On top of that, please be aware that having one or more signs does not mean you have bipolar depression. You must go through proper medical diagnosis to make sure whether you have bipolar disorder or not. Thanks for watching. If the information was helpful, please consider subscribing.